Biceps tendonitis causes and treatment. Biceps tendonitis is a condition that affects the area between the bicep muscles where it meets the front of the shoulder. It hardly occurs on its own, and often biceps tendonitis is often called bicipital tendonitis. The most common cause of bicep tendonitis is repetitive use and strain caused due to the usage. Repetitive strain and usage can come in many forms and many sources. Strain is the major cause among bodybuilders and athletes. It tends to develop when the athletes and bodybuilders put the tendons under too much strain without any proper warming up, or the more strain that the tendons could not manage. This can be avoided by corrective training techniques. There will be some pain when you move your shoulder or arm. There will be pain if you raise your arm above your shoulder. When your shoulder is touched, you will feel the pain. Shoulder may be red and swollen, or you may feel a burning sensation around the shoulder. Your pain gets worse in the night or when getting up in the morning. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the Sinew herbal ice on your arm to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the arm. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your arm with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your arm with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice to your arm to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.